Hello, I'm Dr. Gregory Davis, gynecologist in Chico, California. Thank you for joining me. What we're going to do is talk about painful intercourse. I have a lot of patients that come to me complaining of painful intercourse, or they've been referred by their primary care physician. So what I thought we would do is kind of go over some of the causes of that, some of the treatments for that, and I hope that this information is helpful to you. So let's talk about some of the causes of painful intercourse. The first is endometriosis. Endometriosis is a condition where women that have that usually have painful periods. They may have had their very first period was painful. They may have pain with bowel movements, but they can also have pain with intercourse. So one of the first things I think about when somebody comes in and says they're having pain with intercourse, I think of endometriosis. And the reason for that is that if you could be in surgery with me and looking over my shoulders, we're looking on these big TV monitors, and I'm looking down in the pelvis, right where the uterus and these ligaments that hold the uterus, they're called the uterosacral ligaments, right at the top of the vagina is the most frequent place that little endometriosis implants are going to start to grow. So what happens is that those little endometriosis implants have the ability, when they're irritated, to release a chemical called prostaglandin. Prostaglandins can cause bloating, cramping, nausea, vomiting, and of course pain. So what happens, ladies that have endometriosis and have those little implants sitting right at the top of the vagina, during intercourse, when those get irritated, those release prostaglandins, and that's why sometimes after intercourse ladies will have bloating and cramping and they just don't feel good. It can go on for hours. So the only way we can really diagnose that is through laparoscopy to look inside. The beauty of the laparoscopy when we're checking out somebody for endometriosis is that not only can we make the diagnosis, but we can surgically remove those little implants. And when I remove those implants, then there's no place to produce prostaglandins. The tissues heal. That frequently takes care of the pain with intercourse. Now, one of the other causes of painful intercourse is IC or interstitial cystitis. Now, if you've watched our video on interstitial cystitis, we've kind of touched on that. And what happens is that if we look at our diagram of the bladder, we've taken the bladder, we've taken the front of the bladder off, so the anatomy is like this. We've taken the front off so that you can kind of look at the floor of the bladder. The floor of the bladder is this red area, and the red area is estrogen dependent, and it's the only part of your bladder that has sensory nerves that gives you a sensation of pain. So guess what? This area is located right at the top of the vagina. So when you're having intercourse and they're thrusting and pushing up in here, they're hitting this part of the bladder, which is the most sensitive part of your bladder. So if this area is thin and irritated and doesn't have enough estrogen, and these nerves are getting firing, then they can cause a lot of urgency, frequency, and of course pain. And so sometimes ladies during the middle of intercourse will have to stop to go to the bathroom because they're having so many spasms. So interstitial cystitis is another cause for painful intercourse. Okay, let's look at number 3. Number 3 for painful intercourse is low estrogen. Well, as we just talked about, looking at the floor of the bladder, if you don't have estrogen there, that's going to trigger some irritation to your bladder. But the entire vagina, of course, is estrogen dependent. So if you don't have enough estrogen, several things are going to happen. The pH in your vagina is going to become more alkaline. You're going to get overgrowth of yeast. You're going to get overgrowth of bacteria. But more importantly, when it comes time for intercourse, no matter how much foreplay you have, you're not going to lubricate. You've got to have enough estrogen for the vaginal tissues to lubricate. So ladies that are low on estrogen are going to have a lot of pain with intercourse. Obviously, this happens when ladies get into the menopause. It may happen when some ladies stop their hormone replacement therapy. But the key thing is making sure you have enough estrogen is one of the first things I do when I'm interviewing or looking at somebody for why they may have painful intercourse. Now, let's look at number 4. Number 4 is prior surgery. So if you've had bladder surgery or you've had what we call an anterior repair, where they've done any type of vaginal surgery, there's going to be the possibility of some scar tissue there. And that scar tissue is never as flexible, never as stretchy or elastic as is your normal tissue. So if you've had prior surgery, especially if you've had prior surgery and you weren't put on estrogen therapy afterwards, those tissues may become scarred down and may become kind of irritated. So what happens is that may cause some pain. If you've had pelvic reconstructive surgery and they've put a mesh in there, that mesh can erode through, and if your tissues don't have enough estrogen, then they start to become thin. When they become thin and you've got a mesh underneath, what's going to happen? Well, that mesh is going to erode and come through, and it's going to cause some pain. So it's really important, if you've had prior pelvic surgery, pelvic reconstructive surgery, bladder surgery, you really need to be on some estrogen to help those tissues to be nice and healthy, and then you'll lubricate okay with intercourse, and that should help with the pain. The final thing is ladies that have been assaulted in the past. So when somebody comes in, that's not something that they walk in and they just say to me, hey, I've been assaulted and stuff. That's one of those things that you kind of have to pull that information out. It's very difficult to talk about that just period, not alone with a gynecologist you may never have seen before. So when I'm going through my history and I'm getting to know my patients and I'm talking to them, I'm thinking endometriosis, interstitial cystitis, low estrogen, prior surgery. I'm kind of clicking off all of those things. When I go through there and I don't really have anything that's kind of come up on there, then I will ask, has there been any prior assault or anything like that? And you know what? When that comes up, then that makes a lot of sense, because what happens is that ladies that have been assaulted, obviously that is an extremely traumatic situation. And so when ladies have intercourse after that, even having a pelvic exam elicits memories of that, and that can be extremely traumatic. So what I do frequently when I'm seeing somebody that may have had this, I'm not doing a pelvic exam the first time we're seeing them. It's going to take a while. They need to see me several times and feel comfortable before we kind of do a pelvic exam. But the thing is that ladies that have been assaulted may or may not have really gone through the grieving process. And so I take an opportunity to talk to them about the grieving process. You can see one of our videos on YouTube, and I talk about the grieving process. These are the classic patient that really need to work through that anger phase, and you'll see on the grieving process how we talk about that. The interesting thing is that once they open up, they talk to me about it, we talk about the situation, then I kind of go back and talk about what's been their history with intercourse after that assault and where are we today. And frequently what happens is that they may or may not have enough estrogen. And what happens is that even if ladies are in an age where they should be making enough estrogen, they get tense, they get just the thought of having intercourse all of a sudden brings back flashes of that, and then what happens is that they shut down, they don't lubricate. So it's ladies that have been in this situation, if they're married or not married and they're going to be having intercourse after that, it takes a long period of time to get back to having normal intercourse. And how do we get to that point? Well, we go through a desensitization process. And so what I tell my patients is I say, you know what? We do an exam, finally get to the point we do an exam, make sure everything's normal. I reassure them everything's normal. There's nothing abnormal, nothing has changed, there's no tears, there's nothing that their tissues look okay. Gives me a chance to assess to see if they have enough estrogen. So then I talk to them and I tell them, I say, okay, we kind of talk about it, we say, you know what you need to do is real important that you have times of being intimate. It's just that you're not going to have any penetration. So you and your husband, you and your partner need to talk about that. And the rules of the game are, you're going to have times of being intimate, you have manual stimulation, but you're not going to have penetration. So right away, you can relax and you go, okay, I'm not going to have any penetration, so this isn't going to hurt. So then after doing that for several weeks to a month, maybe even longer, then you go, okay, I'm ready to go to the next step. The next step is that in the process of being intimate, your partner or husband can put a finger, some lubricant on it, in the vagina, not moving around, just leaving the finger in for a short period of time. And then you get used to that and you go, you know what, okay, I'm all right with that. And then that you may go for 4 to 6 weeks, and then you're okay with that. The next step is 2 fingers in the vagina for 4 to 6 weeks, doing that on a regular basis. And then the final step is that you're having penetration, but you're not having ejaculation. Just penetration for a short period of time, have to pull out, and you go, okay, that works. I didn't have the pain. Everything's okay. I'm lubricating all right. So once you've gone through all of this desensitization process, now you'll be able to enjoy intercourse and not have the pain that you had before. But you got to have a partner or husband that's willing to work with that. They have to understand it. I find, some patients want me to talk to the husband about that, and so I have him come in and I go through the whole thing again. And it really helps when the husband hears it from me that, she's not making this up. I mean, this is something that I've seen. I see lots of patients, unfortunately, that have been in this situation. And I give this talk, not because ladies have been assaulted, but because their estrogen may be low, or they've had surgery, or they haven't been sexually active. Now they're 70 and they got remarried. A lot of situations where ladies are going to have some pain with intercourse, and I give this whole desensitization process talk. I probably give that 3 or 4 times a month. So it applies to several different areas, but ladies that have been assaulted, it's really important. It takes some time. Got to talk to your gynecologist, may talk to your counselor. Sometimes going to a sex therapist may be helpful also. I hope that this information is helpful for you if you're suffering from painful intercourse.